The statement. The Honourable Kyle McGinn.
As a member for the Mining and Pastoral Region, my electorate covers over 2 million square kilometres and includes many remote communities, including the Kimberley region with 221 communities, the Pilbara region with 24 communities and the Goldfields with 18. For those needing to travel to Perth for treatment, we recognise it can sometimes be daunting and intimidating experience, especially for those from remote communities. For those whom English may be a second language and they may never have travelled to Perth before, let alone been to a tertiary hospital. At the last election, the Labor government made an election commitment for Aboriginal people from remote communities visiting Perth for medical treatment, a meet and greet service. To be welcomed by an Aboriginal person on arrival at the airport or train station and taken either to their accommodation, normally one of the Aboriginal hostels such as Allawa Grove and Durbal Bidja, or directly to their medical appointment, helps reduce anxiety associated with the trip. This service reduces non-attendance at medical appointments and improves the culture safety of health services. That's why the McGowan government provided $1.9 million over 4 years in the current state budget, delivering on our election commitment to expand the meet and greet service to operate extra hours so that eligible patients be met on arrival in Perth and taken to their accommodation. Country Health Connect has been running a limited meet and greet service which operated on weekdays between 8:30 to 2:30 p.m. Sadly, the demand for this service often exceeds their ability to provide culturally safe service, which results in taxis being used or, worst, patients arriving at the airport from remote communities being stranded with nobody there to pick them up and no guidance on how to get to their accommodation or their medical appointment. I'm pleased to report that the progress has now been made on phasing in an expanded meet and greet service to give better hours of coverage to better align with flight and arrival times. The first phase of this expansion has started and an extra Aboriginal health driver started on the 13th of November, enabling service times to increase from 8 a.m. to 2:30 p.m. to now run for 12 hours a day, from 6 a.m. to 6 p.m, where there is the demand for it. It is intended that these hours of service will further increase when there is staffing capacity. I think this is a great delivery from the McGowan government, and this will help people that need the service to access it. Thank you.